Good afternoon. I'm Dr. Bonnie Henry, the Provincial Health Officer for British Columbia, and today this is our COVID-19 update for today, May 30th. And I'm very grateful to be talking to you from the traditional territories of the Lekwungen-speaking people of the Songhees and Esquimalt First Nations. So today we have 11 new people who have tested positive for COVID-19 in British Columbia, bringing our total to 2,573 people who have tested positive for COVID-19. That includes 902 people in the Vancouver Coastal Health Area, 1,285 people in the Fraser Health Area, 127 people on Vancouver Island Health, 195 people in the Interior Health Region, and 64 people in the North. We have no new healthcare outbreaks today, and on very good news, we have 2 that are now declared over. One of those is Evergreen House, and the other is one of our first and most difficult long-term care facility outbreaks, the one at Harrow Park. And so we know that residents were severely impacted by COVID-19 very early on in our pandemic, so this is very good news, and I'm relieved, and I want to express my gratitude and our thanks to all of the care teams who worked in Harrow Park in a very challenging time, and where we knew very little about this virus early on, and we knew how challenging it was for all of you. I also want to send out my condolences and my support to the families and the residents of Harrow Park. I know this has been a challenging time, and I'm just extremely pleased that this outbreak is now over. We have 14 active outbreaks that continue, 13 in long-term care and assisted living and 1 in acute care. And we've had an additional 3 people who have tested positive in those situations, 340 residents now and 214 staff who have been affected. We have no new community outbreaks, and we continue to monitor and support at all of the community facilities that we have had outbreaks on that continue now. So that means we now have 228 active cases in the province. Of those, 35 people are in hospital and 5 are in critical care or ICU. And another positive note today, we have no new deaths to report in the last 24 hours, and that, again, is very positive news. We have 2,181 people who have fully recovered from COVID-19. In the last few days, the numbers of new cases continue to stay low. And this is, as you know, in our second week of our restart. And that is very good news. That's very encouraging. But these new cases continue to be our elders in care, and there continues to be low, but some spread in our community. This tells us that we still need to be cautious. We need to proceed with care, and we need to keep doing what we are doing to prevent transmission. And that goes back to the fundamental things that we have been talking about from the very beginning. That is staying away from others if we're feeling unwell, washing our hands regularly, covering our mouth when we cough. It means making sure that we keep that safe physical distance between us and that we limit the numbers of contacts we have. I also want to remind people that this is the last weekend to complete our Your Story, Our Future survey that will help us understand the impacts that the measures that we've had as well as the pandemic have had on communities across our province. Over 340,000 people have taken the survey so far, but it closes tomorrow night at midnight, so now's your chance. And please, if you've not had an opportunity, the survey is available both online or you can call in multiple different languages. And please, if somebody that you know doesn't have access to technology, give them a hand and help them complete the survey as well. Now that we are 2 weeks into our restart, coming up on Monday, our K-12 schools will reopen to in-class learning for the remainder of the school year. I know this is very exciting, and I know for some people they are thinking about this with trepidation, and that is fine. We are ready for this, and we are reopening schools because we believe it is safe to do so. We've learned a lot about COVID-19, where the greatest risks are, where the measures we can take to protect ourselves, and we've talked about those, we've practiced those, and it's been working. As we've restarted our economy, as more people are getting out, we are using these measures to prevent transmission of this infection. And that will be what we will be doing in our schools come Monday. My team and the team in public health has been actively working with many people in our education system, and we have confidence that the approach that we've put in place in schools across this province are the appropriate ones and the ones that will keep us all safe. We know that COVID-19 has a very low infectious rate in children, and that children mostly have milder symptoms, and that's a good thing too. We also know that transmission in children usually happens in the household context, where you have a lot of contact from an adult to a child. And we've had 77, to add up my numbers, we've had 77 young people under the age of 19 who have tested positive in BC. So that is less than 1%, and that is despite thousands of children having been tested. So those are things that we have been watching carefully over the last few months, and particularly in the last couple of weeks. We purposely timed the reopening of schools to be sure that we had a period of time of an incubation period to see if we were going to start seeing increased numbers of cases in our communities once we started our restart program. And if we had seen an increase, then we would have postponed or delayed the start of schools. So I am comfortable with what we've been watching, that we are in a place that we can do this now. It is important for us to start this voluntary in-class instructions now to support those children and families who need it. And there are many of those around this province. But it is a cautious approach that we are taking. And this cautious approach as well will help us learn and help us understand and have the tools that we need for a broader reopening come September. So I'm excited about what's going to happen. We will be there watching as well and making sure it'll be a learning experience for all of us, for educators, for children, and our school health officers, which are your local MHOs, and public health will be there to support you to make sure that we have everything in place to ensure a safe restart next week. I know many parents are returning to work and also busy planning summer plans. Many of us will be exploring and enjoying the many beautiful spots that BC has to offer. But as I have said many times, we are not yet in a normal situation. And some of the things that we would normally be doing in the summer are not safe to do right now because of the virus. Recognizing this, I have put a new provincial health officer order in place restricting the operation of overnight camps for children and youth. Such camps often have large numbers of children coming from many different areas, campers and counselors, and they often take place in more remote areas, and physical distancing is very much a challenge in these situations. I know that that's a disappointment for many groups who are used to having that important part of their summer, but I would encourage everybody to focus on arranging day camps where staying outside in smaller groups is far easier to do and will be safe. And I remind people that this is not forever, but it is this summer that we're in a very unusual situation around the world, and globally we're having to do things differently this year. I also want to have a little bit of a cautionary tale. Large gatherings, we know, are still a significant risk for transmission of COVID-19. And this is because the more people you are around, the higher likelihood that somebody, generally inadvertently or without realizing it, may have this virus. It is still in our communities, although at a very low level, and we need to keep it that way. And that means we need to adhere to that mantra of few faces and bigger spaces. We have seen across this country in the last week where this has led to, and we're not adhering to this, has led to outbreaks, particularly in Saskatoon, where a large gathering, somebody inadvertently had the virus and it spread despite it being outside, where there was quite a lot of close contact and it spread quite widely in that family. And we have also seen in New Brunswick where a single person can bring it back into a community and it can have devastating effects if they're not open about making sure that we can be tested and that we stay away from others when we're ill ourselves. We know that a family get-together, a workplace meeting, or religious service, these still remain high risks. And that is the reason why we still have our limit on gatherings at 50, and that includes the need to adhere to our physical distancing, keeping those safe distances between us to make sure that we don't give this virus a chance to resurge. We don't want to put aside the sacrifices we have all made in the last few months and undo the progress that we have made. So to keep COVID-19 at bay, I'm asking you again to stay slow and keep low numbers of people around you. Move slowly with thoughtful consideration, and let's keep our curve flat at schools, work, friends, and family. Let's all do our part together as we have been doing, and we will make it through this. And we will make it through this with keeping ourselves together and making sure that we stay kind and we stay calm and we will be safe. And thank you very much, and I'm happy to take questions.
Thank you. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question. Please also take your phones off mute. You will not be audible until I call your name. First question today is from Bethlehem Miriam, News 1130.
Hi, Dr. Henry. Thank you so much for taking my question. You did touch about this with schools reopening. Just looking at Quebec, I mean, over 40 staff and students tested positive for the virus in the first 2 weeks after schools opened. Obviously, they have more cases, but could you just talk about whether or not there could be parallels here? You know, some people do have those concerns in BC. Can you touch on that?
Yeah, so it was not unexpected in Quebec that small numbers of people would bring the virus into the classroom, inadvertently, of course, and that it might have some spread. And so they were prepared for that, and they've been monitoring that, and it's been managed in those situations. So that is a very small number over the number of people who've returned to classes in Quebec and over the period of time that we're talking about. I will also note from discussions with our colleagues about that, because this is something, of course, we've been paying attention to, that in most often it was an adult who brought the virus inadvertently into the situation. So this is why we need to continue to be so vigilant about any risks that we might have to coming in contact with COVID, or if we are feeling unwell ourselves, and to have that very low threshold. So it is possible, and I would not be surprised if we did have 1 or 2 cases perhaps arise in our schools in the coming weeks. But that's okay. We know how to deal with this. We know that it is not easily spread, and we know we can prevent it by putting in place the measures that we have in our schools. And it's going to be a bit of a challenge. It's going to be anxiety-provoking and exciting for a lot of people in the coming weeks. And I think Monday and Tuesday are going to be very fun days for kids, but it's also going to be a little bit anxiety-provoking for all of us. And we'll need to learn. We're learning the things that we can do in our social interactions, and we've learned that over the last couple of weeks. And I had a really good call with a number of the leaders in the Teachers Federation yesterday, and you know, these are the things that they're preparing for, so that we can all support each other in the coming days.
Next question is from Vaughn Palmer, Vancouver Sun.
Good afternoon, Dr. Henry. Thanks for taking my question. A report out of Washington State late in the week indicated that they're starting to see a significant number of their new cases are under the age of 40, people under the age of 40. And I'm wondering if that's also been the case here in British Columbia, which sort of flies in the face of the idea that it's just oldsters that are getting it under the age of 40. Also, could you provide an update on serology testing in BC, where we stand and when we might see some results from that here?
Sure. So, under the age of 40, we have had a fair number. I think it's about, actually, I was just looking at this earlier. So we've had 442 people between the ages of 30 and 39, so that's about 17%, and 260 people between 20 and 29. And then, as I mentioned, 77 people under the age of 19. So that's a good proportion of the cases that we've seen. Our new cases tend to be staff or residents of long-term care, also workers in settings like the poultry plant. So they tend to be younger people as well. So my understanding from my discussions with my colleagues in Washington State is that they're seeing a very similar thing. So it depends on where the people are picking up their infections, what age group we're going to see. So our cases tend to be younger women, and that reflects the fact that a good proportion of them are people who work in our long-term care system and our healthcare system. So in Washington, I haven't seen the details of it, but my understanding is it's more reflective of people who are getting infected in workplaces and other settings as they start to reopen. In terms of serology, it's been a challenge. And we keep saying, and I was actually saying this to Dr. Krajden recently, you keep telling me it's going to be in the next week or two. The challenge has been that even though we have some tests that are approved for use by Health Canada, the labs across the country have been working hard to validate those tests and to ensure we understand how they work in the real world, which means understanding the false positive and the false negative rates of those tests, and we're still in the process of doing that. Right now, the latest tests that have been done, I think I mentioned we've been using people that we know have tested positive for the virus with the NAT test to try and validate the serology tests. And what's happening now is that we need to do more than one test on each sample to understand exactly what are true positives and false positives, and true negatives and false negatives. So that's taking a lot longer than we had hoped. But they do tell me that we're getting there, and I hope we'll see some numbers, and I can only quote Dr. Krajden in the next week or two. So sorry about that.
Chad Pawson, CBC.
Yeah, hi, Dr. Henry. Thanks for taking the questions. Most people are reporting, TransLink saying they're going to increase the capacity of their bus system, remove the signage on the seats for the half capacity and get up to 2/3 capacity. Just wondering what your part or your officials' part have been in the dialogue with transit providers as they lift those type of restrictions, and what is your concern about more people being on buses? What do you want people to be mindful of?
Yeah, so our team has been working with WorkSafe BC and TransLink to make sure that there's a rational plan that supports people being able to physically distance as much as possible. And of course, we know that part of that could be people wearing non-medical masks whilst on transit. Having said that, we also know, and I've said this many times, not everybody is able to wear a mask for a variety of reasons, and particularly people with disabilities may have challenges with that, and we need to, if they're going to increase capacity, then we need to also increase the numbers of buses, for example, so that people do have the ability to maintain that safe physical distancing. I'm not involved in the day-to-day details of that, but I know that there's ongoing discussions about how to do that safely. That's occurring between our team, WorkSafe, and Transit.
Next question is from Richard Zussman, Global News.
Farms that have youth picks or other activities where people can go, is that okay as the bounty is starting now this time of year? And also for outdoor activities, you've spoken in the past about sports. Is there any more guidance around how recreational sports, both for adults and kids, can take place this summer?
Yeah, so the guidance around recreation activities for kids and for adults around sports is another one of those that's in development. It's taken some time, as you know, and the BC Federation of Recreational the BC, oh, I'm sorry, I forget the acronym. I can get that for you. But they've been working with WorkSafe and with our team at BC CDC to come up with some guidance around that. I think that's will be coming in the near future. And I do expect that they absolutely will be able to have a number of different sports and team sports, but it will be different this year because we will need to minimize the numbers of people, particularly on the sidelines, making sure that they can have physical distancing, minimize the contact parts. And I know there's a lot of discussions going. I was on a call earlier this week with the WHO about how do we do these types of sports in terms of protecting the players and others involved. So there's the recreational sports and also the pro sports, and a lot of these discussions are going on about how to redo some of the aspects of the game to have more protection for players. And rugby is a good example where they've come up with some suggestions that are still being worked through. So it has taken some time, and it will take a little bit more before these come out, but they are absolutely being worked on, and I'm very confident that we'll have some safe sport activities for both adults and children over the summer. And I'm sorry I missed the first part of your question.
It was on U-Picks at farms.
U-Pick.
And whether whether people will be able to go, now that the bounty is starting, whether agricultural activity where people like to go to the farms will be allowed, and what sort of restrictions may be on something like that.
Yeah, I certainly could see that as being an activity that could be done safely with distancing and, families going in your unit together and being able to do that. So I haven't heard from that sector, but I know there's a lot of activity going on in many different sectors that I'm not don't have all the details, but I can see how that absolutely could be, and it could be a very good way. We know that there's been challenges with getting agricultural workers for some of the people who are dependent on them, particularly temporary foreign workers for assisting in agriculture, and this may be a way of trying to bridge that gap so that the important good fruit and vegetables that we have in farms around the province don't go to waste.
Next is Brishti Basu, Victoria Buzz.
Hi, Dr. Henry. Thanks for taking my question. The original Phase 2 guidelines allowed people to expand their social circles to 2 to 6 people outside their household. Do you anticipate increasing this number, allowing people to socialize with more people anytime soon?
Yeah, I think what we heard today from places like Saskatoon tell us a cautionary tale about this. And it really, as we've been saying from the beginning, this expansion of your social circles really has to be taken in the context of your own situation and that of your family. So if your child is going to school, if you're going back to work, then you really want to limit the other connections that you have, because those are all things where you're going to be connected with another group and you're connected with their connections. So those are the types of considerations people have to have. If you're not going back to school, if you're not going back to work, or you're continuing to work from home and do things remotely, then you might want to expand to another family or household or group. But right now we need to hold those limits small. And we see that this can spread very quickly if we're not careful that way. So I don't see that changing in the short term. And particularly, we've been watching, as we say, in these 2-week incubation periods. So we're 2 weeks now from the restart, and then we're going to be starting schools and in-classroom schooling starting next week. So this is not the time to look at expanding other circles as well. Let's watch and be careful like we have been doing, and continue to take those physical distancing measures and all the important things that have allowed us to continue to keep things very low and under control in this province.
Next question is from Leslie Evans Ogden.
Thanks, Dr. Henry. As BC sees a voluntary adapted return to school this week by some students, I'm wondering, I understand that there will be some sharing of student attendance records with public health, and I'm wondering if you can elaborate on the extent to which public health will be using this as a research opportunity to better understand the role of children in transmission of COVID-19?
I'm not sure what you're referring to in terms of sharing attendance records. We would only get those in public health if there was a need to contact students. So schools do need to keep records of what children are together during which periods of time. So if there is a concern, we are able to follow up. And this is what we do with all infectious diseases or communicable diseases in a school setting. So we would do a similar thing for measles or for meningitis. And we don't have any research planned at this time, but we will be, of course, monitoring carefully for the children, the staff, all of the school setting, and making sure that if cases arise, that we are able to very quickly contain those and make sure we can do the contact tracing and the case management that we do for every case of COVID-19, and make sure that we can support the school family in understanding what's happening.
Next question is from John Hernandez, CBC.
Hey there, Dr. Henry. Municipalities and businesses are preparing for local travel, as you mentioned, to open up sometime in June. But during that time, how do we kind of ensure that the numbers stay down, as we've been seeing over the past few weeks, particularly when there might be visitors from other provinces making their way into BC? And also, just a quick note, we've spoken to some experts who say vaccines don't work well on people over 60. Wondering if you can comment on that.
Yeah, so you know how we keep the numbers low and the transmission low in this province is by continuing to do the things that we have been doing. So we're one incubation period almost since we started our restart, and we're doing okay. People are continuing to maintain that safe physical distance, to clean their hands regularly, to cover their coughs and wear a non-medical mask in some situations. And also incredibly importantly, to stay away from others if they're feeling unwell themselves. These are the things that we need to continue to do over the next incubation period. And, you know, people have been, people who've come from other provinces, and there are people from Alberta, and soon there'll be people from the Yukon as well who've come back and forth. And we just need to all continue to take these measures. And so we'll be looking for the next incubation period for the next 2 weeks, and we're doing around that. In terms of age and immunization, yes, we do know that as we get older, our immune system doesn't respond as well to some vaccines. And so for influenza, for example, our immune response may be lesser as we age to the influenza vaccine. And that is one of the reasons why it's so important for all of us to be immunized, to protect those people whose immune systems don't respond as well. And there's a variety of reasons why that can happen. So, but it's not across the board. Some vaccines work very well in elderly people or older people. And, you know, shingles vaccine, for example, is one that does work quite well in older people. So these are things that we need to pay attention to. And when the COVID vaccine, if and when we have one, that's one of the things that we'll be looking at to see who it works best in. And that will guide our strategies for how we immunize people if and when a vaccine is available.
We have one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Keith Baldry, Global News.
Hi, Dr. Henry. Thanks very much for this. In your meeting with your virtual meeting with the BCTF, was there any pushback or fears expressed by any of them on behalf of their members about going back into schools? And when you talk about there might be a couple of outbreaks as a result of schools resuming, are we talking staff people, I assume, rather than children?
Well, I'm not saying there might be outbreaks. There may be individuals, and we'll have to watch that. It's not inconceivable, and it's more likely to be in an adult than a child. But we know that it can happen in both cases. But what we've seen from schools that are open and functioning around the world, that the things that we've put in place should protect everybody in the school setting, and that's what we're looking for. And yes, there was concern expressed by a number of members. Particularly, people are concerned about, what does it mean for me if I'm over 65, or if I have an illness, or what about if I have somebody at home who might be immune compromised. So we had a good discussion about the measures that we're taking are to prevent transmission to everybody. And that reduces the risk, like every other person who's been going to work as well. Those are the things that we know prevent you from getting sick, and that's what we're focusing on. And we do know that for some people, particularly people over the age of 70, and for people who have cancer or uncontrolled diabetes. So it's not everybody that is at more risk of having severe illness if they get infected. So that's what we talked about, and we talked about all of the key things that people are doing that are going to ensure us having a safe school environment next week. And we recognize, I think we all recognize that it is a challenge. It's exciting, but there is some trepidation. People are a little concerned about what this is going to look like, how it's going to feel, and how am I going to resist that urge to hug my friends again. And those are the things that we're preparing for. And for those young people going to school next week, and for those who are staying home, I think that's great. If online learning is working for you and that's a great environment for you, then that's super. And for those who are going back to school, it'll be different, but it'll be new and exciting, and we will all be there to support you. And I think it's going to work out really well next week.
That's all the time we have for today. Thank you.
Thank you.